All right, time for section 4, behavior. Ooh, fun. All right, let's see. Getting text messages. Okay, moving on. Normal patterns of behavior in a developing child. Newborns, development and evolution of social skills. Well, that's pretty well what they're doing, right? They're eating, pooping, sleeping, and interacting with those around them. That's pretty well all newborns do. As they approach toddlerhood, they start to develop more autonomy. They can control so few things in their environment. The things they can control, they're going to exert their very limited control over. So what goes in their mouth, what they're willing to take into their hands, what they're willing to do with what's in their hands, what they're willing to play with, whether they're willing to go to sleep. They're beginning to become their own individual person, and that continues to develop over their life course. So school-age kids are beginning to become more independent. They become more aware of their gender identity, of who they are. They focus a lot on who they are and how they function in their local environment, in their classroom, with their peers. They begin to become more aware of their peers. And then in adolescence, they become more aware of those around them and how those around them think and feel. And that development continues on as their brain continues to mature. Describe how somatic complaints may represent psychosocial problems. Yes, we see this all the time. Kids come in with recurrent abdominal pain, headaches, fatigue, neurological complaints, all the things that are listed here. And it could be for a variety of reasons. They're stressed, and they don't know how to express that. They don't have the coping skills and maturity to deal with that. Sometimes they don't understand. Hyperacid secretion in the stomach is physiologically a response to stress. And so we have to do some things. We have to modify their microbiome sometimes to help with that. Sometimes they need a little acid reduction to help with that. But psychological issues, psychological stress, depression, anxiety can very much have an impact on how your body functions and feels. So it's just important for us to be aware of that. And to make sure we rule out the medical stuff, but to be aware that psychosocial component can play a role. Know the typical presentation of common behavioral problems in specific age groups. So newborns and infants can certainly present with colic, that crying several hours a day, several days a week. Nothing you do makes a difference. We don't really know what causes that. Some people think it's an issue with their microbiome. Some people think it's bowel spasms. Some people think it's sort of brain overload or reset time. To manage that, we often use the 5 S's. So swaddling, side lying, sucking, swaying. I refuse to say shaking. He says shaking in the 5 S's book. And sucking. And that's Happiest Baby on the Block. I don't remember the author, but you can Google it. It gets credit for those 5 S's. And know that it will pass. It's very important to stress to the parents that if the crying stresses them out, put the baby in a safe place and go outside where they can't hear it. Calm down, then go back inside and deal with the baby, or call for reinforcements. Call grandma, she'll come love on the baby. Sleeping problems in infants. Infants don't develop REM sleep until they're about 6 months of life, so you really can't modify their sleep cycle until then. But after that point you can. Now what's right sleep-wise for an infant really is quite variable. It's social, it's cultural. As long as they're in a safe sleep environment on their back in their crib by themselves with nothing else in the crib, what time they put them down, how often they get up to feed them, I really don't care. There's no one right answer. There's a great book, Healthy Sleep Habits, Happy Child, that I recommend that talks about the physiology of sleep and ways that it can be modified after that 6-month mark. But sleep problems we do get a lot of questions about that. All right, toddlers and temper tantrums. Oh, toddlers. So toddlers have very limited language skills, and they have a hard time expressing themselves. And that's often the source of toddler frustration and tantrums. So if we can just break it down, try to understand what they're mad or frustrated about, and encourage them to use their words, oftentimes that can help to solve the difficulties that they're having. We can prevent tantrums by giving them language. So a lot of times we'll sign or teach toddlers to sign before they're able to develop verbal language. So ways to say more, ways to indicate what they're wanting, milk, eat, more, please. Ways to indicate their wants without having to use language are really important. And just remembering to be patient and listen. Your toddler is a person that's trying to express themselves, so listening to their individual wants and desires and not kind of being too wrapped up in adult life to hear what our toddler's trying to tell us are really important. Sometimes tantrums are simply a cry for attention, so making sure that we are providing attention when the toddler is doing what they're supposed to be doing as opposed to when they're tantruming is really important. So for that, we recommend time in. So when you notice a toddler that's doing what they're supposed to be doing, you say things like, "Oh, you're so amazing. Thank you for sitting so quietly while Mommy got the dishwasher loaded. Thank you so much for playing quietly with your doll while Mommy did such and such. Thank you for taking care of that while Mommy was on the phone. Let's play a game now." Those kinds of things are the right way to handle that. So making sure they're getting lots of praise and lots of good feedback when they're doing what they're supposed to be doing. And then making sure that you ignore the bad behaviors to help extinguish them. I usually recommend parents put their toddler in a safe place, like in a pack and play or in their crib, and then just leave the room when their kid's having a tantrum. If they're in a public place, the best thing you can do is just go to the car, strap them in their car seat, and plug your ears and just let them go. Let them have their tantrum till they're done, and then once they're done, say, "Okay, we're ready to talk about what happened," and let's go in from there. Toilet training, we get a lot of questions about that. Parents are done buying diapers and they want to know how to get that kid to poop in the potty. A lot of times toddlers will tell you when they're ready. I encourage parents to pay attention to signs. Let them see the older siblings using the potty or the parents going to the restroom so that they have an idea of what the toilet's for. Set the toddler potty in the middle of the floor in the living room. Let them play with it so they're not fearful. Read books about it. Watch Elmo episodes where Elmo goes potty so that they are not fearful of pottying. Reward strategies are helpful. Sticker charts. I don't like to use candy for rewards. That's building bad food habits. We don't associate pleasure and food together. Let's not build another generation of obese kids. Let's try to not use food as rewards. But sticker charts are great. We can work towards prizes or time with parents. Pooping in the potty is usually the challenge. Most kids will TT before they'll poop in the potty, but making sure we use that positive reinforcement. I also like natural consequences, so we don't punish when accidents happen, but natural consequences are a reasonable approach. So for instance, there's a book called Potty Training Boot Camp, and that book recommends that if the child has an accident, then they have to help clean it up. So if the child has an accident, you go to the potty, sit them on the potty, let them try. Once they're finished with that, they have to go and clean up the accident, along with the parents' help, of course. So, wet underwear has to go into the washing machine, and they have to get paper towels and clean the floor before they are allowed to go on and play. Feeding problems, again, toddlers can only control very limited things, and what goes in their mouth is one of those few things. So oftentimes they're picky about what goes in their mouth. It's best not to get in a power struggle with a toddler. Offer them what you're having for dinner, and if they choose not to eat it, then they don't eat. That's it. I usually recommend at a meal you have one thing that your toddler generally will eat. So if they really like green beans, have green beans at the meal. But don't be a made-to-order chef. Don't fix chicken nuggets and mac and cheese every meal because that's all your toddler will eat. That's all they'll ever eat if that's all you fix. They say you have to offer a toddler food an average of 10 to 15 times before they'll try it. As long as it's texture appropriate, we avoid those round choking hazards, peanuts, grapes, hot dogs, unless they've been cut up properly. Then we want to, then we should be okay. Make sure we continue to offer them new foods. School age, enuresis. Enuresis is wetting accidents. Nocturnal enuresis is normal up until the age of 7. But really, there are a good number of adolescents that still have wetting accidents, whether that's due to a weak pelvic floor or perhaps due to overindulgence in caffeine or obesity or ADHD. Nocturnal enuresis can be associated with that as well. That is common. We want to make sure we're asking questions, treating any constipation that's there, and reassuring them that for the most part it's really normal and it's really common. School age kids, attention deficit disorder is also common. We want to make sure that we're screening for that and asking appropriate questions, particularly if they're having trouble learning at school. So it's very important at every checkup to ask about school performance. How is the kid doing? Does the teacher have any concerns? Because sometimes the parents don't have any concerns or they don't care, but the teacher may have concerns, and if you ask, the parent will tell you or the child will tell you. We use the Vanderbilt form for screening for attention deficit disorder, and you may have seen that in whatever clinic that you're working in. One of the criteria for attention deficit disorder is that it should have been there their whole life. This shouldn't be something that's just developed. If it's just developed in a high school kid, we probably need to go looking for something else. Encopresis is stooling accident, so they get really constipated and a big giant ball of stool builds up in the colon, and then you get leakage of liquid stool around it, and parents can't understand why the kid is constipated but having diarrhea, but it does happen, and it happens because of stool withholding, typically due to pain or impatience with stooling. Adolescents, eating disorders. I've seen they typically say 2 kinds of eating disorders. So there's your bulimics, your binge and purgers, and then your patients with anorexia. I'd also like to mention as a part of eating disorders, your athletes that like your protein supplements and shakes. That can get them into some trouble later on, so you want to make sure you're screening for that as well. Risk-taking behaviors, their frontal lobes are not myelinated. They do not have adult brains. They do not have adult decision-making capabilities. They need supervision. It's important to be talking to them about why these behaviors are dangerous, and it's important to be limiting opportunities to take risk-taking behaviors. They do not have mature brains. They're not adults. It's important to tell parents this. The parents expect them to make mature decisions, and physiologically they can't. They do not have myelinated frontal lobes. Conduct disorders, screening for those. If you got a kid that's acting out, it's important to be looking for those things, along with mental health disorders, which we'll get into in just a little bit. So that is bullet point number 4.